Mr. Deputy Speaker, I thank Dr. Tan Wu Ming for highlighting the difficulties faced by families with children suffering from rare genetic diseases. As a parent, I empathize with the challenges all parents encounter and the daily struggles we have to go through to care for our children. Parents of children with rare diseases will undoubtedly face even greater challenges. I agree with Dr. Tan that as a caring and inclusive society, we should pool our resources together and do what we can to support these families. It is the right thing to do. Singaporeans have access to good quality, subsidized healthcare at public hospitals, specialist outpatient clinics, and polyclinics. Many of our subsidies are means-tested to provide more support for Singaporeans with lower incomes. And this is part of our progressive social policy and safety net. Now, on top of government subsidies, we have MediShield Life, which provides universal protection for all Singaporeans against large hospital bills and costly outpatient treatments through risk pooling. The government provides means-tested subsidies to help Singaporeans pay for their MediShield Life premiums. We also offer financial assistance for low-income Singaporeans through additional premium support to ensure that no Singaporean will lose coverage because he's unable to afford his premiums. So MediShield Life, as Dr. Tan pointed out, is not just an insurance scheme. It is a social policy which reflects our values as a community to build a fair and just society. For needy families who still require financial assistance after government subsidies and MediShield Life payouts, and using their MediSave and other personal savings, we have MediFund as a further safety net to ensure that no Singaporeans will be denied access to appropriate care due to their financial situation. These social policies and assistance schemes are possible because we have grown our economy over the years, we have generated the required resources, and we have managed our system efficiently. Now, as we face an aging population in Singapore, we must continue to pay careful attention to these important areas. Now, with these policies in place, the vast majority of Singaporeans are able to pay for their medical treatments and drugs. Yet, as Dr. Tan has pointed out, even the best policies cannot address all circumstances. There will be rare diseases where treatments and drugs are very expensive, and our insurance schemes, our subsidies, will not provide adequate coverage for the patients and their families. When we encounter such cases, our public healthcare institutions will do their best to help. And there was a recent example in one of our public hospitals, a patient by the name of Emily, who was diagnosed with Pompe disease since she was a teenager. Emily needs to visit Changi General Hospital, or CGH, every fortnight to receive an infusion of her missing enzymes, which is a costly drug. Combined with other aspects of her treatment, such as consultations and tests, the monthly cost adds up to more than 50,000. Emily's father is a technician, her mother is a homemaker, and she has a sister who is still schooling. Financially, it is very challenging for the family. CGH reached out to the family and brought in other parties to help. Emily received subsidies for consultations and investigations, and the hospital helped her apply for funding under the Medication Assistance Fund. And these covered a significant proportion of the infusion cost. The hospital also engaged the pharmaceutical company, which kindly agreed to extend financial assistance to further defray the cost of the medication she needs. And more recently, after discussing her situation with the hospital, her employer helped her to claim part of her treatment costs from their group insurance policy. So through the combined efforts of CGH, the pharmaceutical company, and her employer, Emily's monthly healthcare expenses were reduced from more than 50,000 to less than 500. So I'm heartened to know that Emily is coping well with her treatment. Another example is Chloe, a little girl with the same condition as Emily. So like Emily, she needs to visit the hospital regularly to receive the infusion of enzymes. Her monthly treatment cost is about 40,000. And this is another example of how multiple parties have come together to support the family. Government subsidies were provided for her treatment. The family's insurance policies covered the post-subsidy costs of Chloe's inpatient treatment, and additional government and hospital assistance supported the other aspects of her treatment, such as mobility devices and consumables. So together, these helped to reduce Chloe's healthcare expenses from $40,000 per month to less than $500 a month. Dr. Tan also mentioned in his speech a young boy, and the name of this boy is Christopher. He was diagnosed with a rare disease called bile acid synthesis disorder. We want to help the family. The public hospital which is looking after Christopher is KK Women's and Children's Hospital, and they are working with the manufacturer to try and bring down the cost of the drugs for the family. I've also asked my colleagues in MOH and KKH to assist Christopher's family and find a way to help them to reduce their out-of-pocket expenses. Mr. Deputy Speaker, while we have many positive examples of how dedicated healthcare workers and caring individuals in our society are helping patients who are facing difficulties, we recognize that there are still families with children suffering from rare diseases who are struggling and worried about how they can cope with their healthcare expenses. And this is not an easy challenge to solve, because many of the cases have unique circumstances and the needs are diverse. But what is clear is that as a caring and inclusive society, we must do our best to find practical ways to help our fellow Singaporeans who are in these difficult situations. And this requires a collective effort from the public, private, and people sectors. MOH will review how we can better support children with rare diseases and their families. We are studying different options, including the use of insurance and discretionary funds like Medifund and the Medication Assistance Fund to reduce their out-of-pocket expenses. Another possibility is to set up a separate fund, which our public healthcare institutions can use on a discretionary basis to help children with rare diseases whose treatment costs remain unaffordable in spite of subsidies, insurance, and financial assistance. Contributions to the fund can be made partly by government, but also by companies, charities, community groups, and individual donors to encourage different stakeholders in society to chip in and help these families and help these patients. The ministry will study the different options carefully, and we will come out with a proposal later this year. By harnessing the collective giving from all parts of our community, we can help these families and create opportunities to encourage philanthropy and build a more caring society. Thank you.